All right. Good morning, good afternoon, or good evening, everyone, depending on where you're joining us from. Welcome to the first in a series Zoonotic TB webinar. My name is Hind Azami. I am a clinical assistant professor at the University of Georgia in Athens in the US, together with Dr. Fred Quinn, who is a professor at UGA as well. We will be moderating this session. Before we start, I kindly ask everyone to mute their microphone or keep it muted throughout. And then if you have any questions during the Q&A session, you can raise your hand and unmute and ask your question. This is the first webinar on the topic of zoonotic tuberculosis of a series, as I mentioned, of webinars that we will be hosting monthly. So be on the lookout for other emails from the union advertising our future webinars. The first few ones will be focusing on the topic of zoonotic TB. Our next one is already planned for October 21st at 11 a.m. At 11 a.m. Eastern Standard Time. So put that in your calendars already, but also be on the lookout for information regarding that with the link to register and all of that. Webinar will be with doctors Francisco Lea Popelka and Dr. Paula Fujiwara, and it will be talking about the zoonotic TB roadmap, kind of updates, what's happened since that was published in 2016 or 17, if I'm not mistaken. Today, we have the honor to welcome two zoonotic tuberculosis survivors, Adriana and Lisbeth. They will tell you their story battling zoonotic tuberculosis. And then at the end, we'll have the agenda is posted in the chat, but we have a 15-minute talk from each of Adriana and Lisbeth, and then we will have a Q&A session where you can ask all your questions. You can put your questions in the chat, but you can also raise your hand if you want to say your question and orally to the group, and we will do our best to address all your questions. So without further ado, join me in welcoming Lisbeth, who will give us the first presentation here. Enjoy the talk.
I'm sorry, I don't know what's going on with my computer. Everything is turning off, so I have to restart everything. So it takes maybe a couple of minutes. But hello, everyone. First of all, I'm very grateful for the opportunity to share my story with you today. My name is Lisbeth Hernández. I'm originally from El Salvador, but I have lived in Long Island, New York for around 4 years, since 2021. So let me try if it's ready. So here. Did you see my screen?
Yes.
Okay, so I'm
Looks great.
So I'm a TB survivor, and this is my story. So I was diagnosed with tuberculosis in March of 2023, but the symptoms started since November of 2022 with dry cough. I lost my appetite and consequently some weight. If you see those pictures, the first one is me before tuberculosis, and the second one is me after my first hospitalization. So if you see a big difference between both pictures. And about the symptoms. In January of 2023, I started with pain under my ribs. I felt so tired, without energy. Then in February of the same year, 2023, I started with pain in my upper back. I started with shortness of breath, with fatigue. I completely lost my appetite at that time. And every night, the pain in my back was getting worse. I remember I only woke up in the mornings to try to help my kids to be ready for school. And the rest of the day, I lay to bed and try to sleep until the kids get home back from school. And I don't have medical insurance, but my husband brought me to the urgent care. And that time they did a thorax x-ray, and they told me that it looked like pneumonia. So they did a blood works to be sure that I didn't have clots in my lungs. And they gave me levofloxacin for around 1 week. That helped me a lot with the pain. And I finished my treatment, and after 2 weeks, the pain in my back was better, but I still felt tired, with shortness of breath, and with fatigue, without appetite. And we decided we went to the urgent care again, and they did another x-ray from my lungs. And they told me it wasn't pneumonia. They told me that it was water in my lungs. I have to be in the hospital, in the ER immediately, because it was very dangerous at that time. So we went to Nassau University Medical Center, and they also did another x-ray from my lungs, blood works, and they told me that in that time that they couldn't do anything because I needed pulmonologist. And the nearest appointment, it was next week after that. And so I wait 1 more week to be to go with the pulmonologist. And finally, I have my appointment, and he told me that needed to do a bronchoscopy. So the same day, I was admitted in the hospital, and they started to give me IV medicine, even they didn't know at that point what exactly was wrong with me. And finally, after 3 days, they did a bronchoscopy, and after that, after 5 days, they gave me the discharge. And they told me that probably I had lupus, and also I had latent TB. So after 5 days, they gave me the discharge, and also they gave me an appointment with infectious disease clinic, and I went with infectious disease doctor, and they told me that that I have latent TB, and I only need isoniazid and vitamin B6. So I started to take the medicine that night, but that same day I started with night sweats, high fever, and pericarditis. So the next day I went to the hospital again with the primary care, And he talked with a cardiologist and with the primary care and with the cardiologist. They decided to stop isoniazid. So I stopped to take the medicine in that time. And after 5 weeks, the infectious disease doctor called me and he told me that I had active TB. So after 5 weeks, in March of 2023, I started with the TB treatment, and I was admitted again. But now they changed isoniazid to moxifloxacin, and they gave me 11 pills every day, and also IV medicine. So I started my TB treatment in the hospital, and after 11 days, they gave me the discharge in that time. So the first picture, it was the second hospitalization. The second one is when they gave me the discharge. When they gave me the discharge, I remember that I didn't have sensitivity in my right foot, and sometimes I felt like electric shocks on my brain, and at the same time, numbness and tingling in my right foot. But I didn't have no idea what's going on with me. I thought it was because of the medicine. So they gave me the discharge, and in April of 2023, I went with my appointment with the infectious disease doctor, and they told me that they received the results of my bronchoscopy, and they discovered that I had Mycobacterium bovis. And that's all information that they gave me about that. They never explained me anything about that. And according to Nassau County Department of Health, I'm the only patient diagnosed with bovine TB in the past 3 years. So I think it's a very, very weird bacteria of tuberculosis. And I really don't know when or where I got Mycobacterium bovis, because I never grew up in farms or closer. And the only time that I remember that I touched farm animals, it was in 2022 in a trip with my daughter. I remember I fed animals, and I fed goats, I touched horses, but it's the only time that I remember. And I genuinely think that the doctor wasn't empathic with me, because they never explained to me anything about that. So in May of 2023, I started with stomach aches, and it was so painful, and I couldn't walk because it was so painful. So I went to the hospital again, and they discovered that I had tuberculosis in my intestine. So I couldn't eat or drink anything for around 3 days. I remember I was very thirsty, starving, but my stomach had to be completely inactive for 3 days. And they gave me the discharge after 5 days. And the next 6 months, I had a low fiber diet. And of course, the same TB treatment. And during those 6 months, I still had electric shocks in my brain, and tingly, and cramps in my right foot. And In November of 2023, I was on my bed when I saw my foot shaking involuntarily. So I took a video to show my doctor, but at the same time, a cramp started in my right foot, and I tried to stand up, but my whole right leg started to shake, and my foot twisted up at the same time, and I fell on the floor, and all my body was shaking. I didn't know at that time, but I was having a seizure, and I couldn't breathe for around 37 seconds. I knew that because the video that I took is about 1 minute and 44 seconds, and the time since I fell on the floor took around 37 seconds. And when the seizure was over, my right leg was completely numb. I couldn't walk, so I tried to crawl with my arms to the door and to find somebody to take me out and bring me to the hospital. And as soon as I got to the ER, they did an MRI of my brain, and they told me that I have a meningioma in my brain. And also my brain was swelling. And the seizures continued during 1 week. They gave me steroids and medicine for seizures, and also my TB treatment. And after 1 week, they gave me the discharge, and I took steroids for 3 months, seizure medicine, and also my TB treatment. And I'm in a TB support group, and it's We Are TB, and they refer to me to the TB support group, but in Spanish, because Spanish is my first language. So in that group, Somos TV, I met a woman who had brain TB, and she experienced the same symptoms like me. And that time, I remember it was a big alarm for me. So I decided to talk with my infectious disease doctors, but I remember they told me that it was impossible that it was tuberculosis because I was in TB treatment for almost 1 year. And if that was my case, the meningioma should be shrink. So after that day, I went with the neurosurgeon. He saw the MRI from November, and they compared with the MRI from January, and he told me that the meningioma was shrinking, and he doesn't have an answer to that. He doesn't know how to explain what my meningioma was shrinking. So I explained to him that I have tuberculosis, and he told me, I remember, oh, now I understand everything. You have a tuberculoma. That's the name that you have. It's not a meningioma. And you have to keep going, taking your TB treatment. And I started to talk with the other doctors. I went with the neurologist, and he told me that it wasn't TB. It's a meningioma. My infectious disease doctor told me it wasn't TB. It's a meningioma. So I started to talk and with the discussion with the doctors, and finally, after 6 months trying to talk with the doctors and almost fighting with them, finally, my infectious disease doctor talked with Global TB, is that one, Global Tuberculosis Institute, and they told to my infectious disease doctors and that I have tuberculosis on my brain. So I have to continue taking the medicine, and for around 3 years, between 1 to 3 years, because the only 10% of the medicine go to my brain. So I has been taking the medicine for 2 years. If you see the pictures, those are my last ones, MRIs. And the first one is from April of 2024. The meningioma is shrinking. In July of 2024, it's smaller, but in October of 2024, it's same size. And the last one is in May of 2025. Same size, any change. And my neurologist told me that the tuberculoma, it's not always completely gone. Maybe always be there, but it's completely, the tuberculosis is completely gone. But around of my tuberculoma, there is a little bit of swelling. So I have to keep going, taking Keppra for seizures. And I finished my treatment, my tuberculosis treatment, in March of 2025. So, and I experienced a lot of side effects from the medicine. I experienced side effects during my treatment and after my treatment. Especially after my treatment, I had nausea, dizziness, tinnitus, anxiety, fainting, blurred vision, and now I have neuropathy because of the medicine. So the neuropathy, it's a big problem now, but after 2 years taking the medicine,
No le puedo explicar la emoción que siento porque ya me dieron el alta. Oficialmente soy una sobreviviente de tuberculosis completamente sana. Ay, gracias, Diosito. Gracias, estoy súper feliz.
So I took that video the day when finally they gave me officially the discharge, and now I'm a TB survivor, but I'm still taking Keppra for seizures for 1 more year, and I'm taking B complex for the neuropathy and gabapentin to help with the pain. And all these side effects are started after my TB treatment, and the doctor told me that recover my nervous system, it took between 2 or 3 years. So thank you so much for your attention. Now I'm trying to help people talking about tuberculosis from my own experience. In my TikTok, you can see my whole story. I did around 8 chapters with my story in videos. So everything, all the information is in Spanish, but if you are interested in that, I always do videos about that, about side effects, treatment, symptoms, and we usually use this logo, We Belong Together, because all the people in my TikTok are trying to understand better with cartoons. I explain symptoms and side effects with cartoons, and it's a good way to understand better. So thank you so much for your attention. And thank you for giving me this opportunity to share my story with you.
Thank you so much, Lisbeth, for the amazing presentation. We'll take questions at the end, but now I will give the floor to Adriana to hear her story.
Hi, I'm Adriana. Thanks, Lisbeth, for sharing that. Me and Lisbeth actually met through We Are TV, which I'll talk about a little bit later as well. So throughout my whole treatment, I had to fight to be heard and taken seriously, and that started with getting a diagnosis. So in June of 2020, I had to get a TB skin test for a job. I had just moved home from college because it was COVID, all the schools shut down, and I moved back in with my parents, my sister, and my brother. The nurses were really confused on how to read my skin test. It was a small red bump. They did the screening questions, chest x-ray, everything was clear. So I was sent home with no information other than it's either latent or false positive. I followed up with my primary care physician asking for a blood test, and I was denied because COVID was the pressing issue and because they thought that there was no possible way I could ever have TB. In August of 2020, I started to get severe chest pain and a cough. I got tested for COVID. I started Googling all my symptoms. And then in the back of my mind, I always had what about that TB skin test? I really did not think I had it, but it was always in the back of my mind. I reached out to my doctor 2 more times in that month, both times denied any further testing at all. 3 weeks after the last time we spoke, I ended up in the ER with a collapsed lung. This was September 22nd, 2020. So in June 2020, completely clear x-ray. September 2020, I had a collapsed lung. In the ER, I told every single nurse and doctor that walked into that room that I had a positive TB skin test, and every single one of them told me there's no way I could have TB. A few days into my hospital stay, after many testing, they did a bronchoscopy. The bronchoscopy took over 2 hours. The doctors could not even find my left lung because it was so full of the germ, and their eyes were just lit up with a mixture of excitement and confusion about what this could possibly be. But still, every day, my doctor was saying that it's not TB, and we were waiting for the cultures to come back. Near the end of my hospital stay, I was, of course, diagnosed with TB once the cultures came back. I was connected to a nurse right away through the health department, and they started me on the RIPE regimen. When I got my TB diagnosis, the first thing I thought wasn't, oh my God, I have TB. The first thing I thought was, oh my God, what if I gave this to my great aunt? What if I gave this to my grandparents? What if I gave this to my little sister? I became so afraid and just overwhelmed with guilt that I could have possibly given this to any of my loved ones. And I also felt so frustrated that I had asked for further testing months ago and was just ignored. When I was sent home, I began the worst 2 weeks of my entire life. I could not eat. I was nauseous all the time. I was throwing up every hour. If I had a sip of water, a taste of food, I was throwing it up. I was not keeping a single thing down. I had chills and high fevers. I was exhausted, and I was pleading with my doctors that something was wrong and being told that I just have anxiety over and over again. I dropped nearly 15 pounds. Walking became so incredibly difficult and painful. I looked like a skeleton. I couldn't even look at myself because it was so scary. And I was crawling to the bathroom to vomit because I could hardly walk. Growing up, I typically would stay in my room at home, but I was so convinced that I was going to die that I moved downstairs to the living room couch because I needed to make sure that someone would know that I was dead. I didn't understand why no one would hear me when I was saying something is wrong because I genuinely didn't know if I would wake up the next morning, and it made me feel like I was absolutely delusional. And the worst part about any of this is knowing that my little 14-year-old sister was watching all of it happen. There were times where I would be coughing and vomiting in my bedroom, choking and screaming for help, and my little sister would run in panicked, trying to put on a mask as fast as she could and trying to see if there's anything she could do. All the while, she's being tested for TB. She's wondering if she's next, if someone we love is next. My sister is an incredible writer, and she wrote a paper on her experience watching me go through TB and how it impacted her, and she lets me share part of that. So in her words, I opened my door just enough to slip through, wincing at the bright light from the hall. The cry from the floorboards betrayed my attempt at stealth as I crossed the inches that separated us. Her door handle was cold against my hand as I turned it to enter her room, just barely stepping in out of selfish fear. I waited, watching as her bony body was illuminated by the moon until her chest lifted, filling with cool air before it fell, then rising again, never breaking the cycle. I stayed and watched compulsively as if my presence would somehow prevent her breath from stopping, like a subconscious encouragement to try. As I watched, I wondered if even her dreams had been corrupted by the disease that corroded her lungs. My sister was so deeply impacted by my experience because this disease affects everybody around it. The statistics we have about TB, about bovine TB, are such a limited and narrow view of how much TB impacts people. We see the numbers about how many people get TB, but we don't get to see how many people are impacted by TB. Despite how horrible these 2 weeks were, my nurse helped me so much during this period. She helped explain things to me. She encouraged me to take it day by day. She would sit there with me while I took my meds very slowly and then sat with my hand covering my mouth so that I would at least not vomit for 1 hour so I didn't have to retake these meds. On a Saturday, at the end of these 2 weeks, someone saw a little bit of yellow in my eyes, and so we called my infectious disease doctors, and they said to come into the ER. I was admitted for drug-induced hepatitis. My ALTs were over 2,000. I wasn't crazy. I wasn't just anxious. I was right. There was something deeply wrong. It's so important for healthcare professionals to balance validating mental health concerns and taking those seriously, while also not using it as an excuse to not look further into physical concerns. I was anxious. I was anxious all day, every day, but I was anxious because of the symptoms I was experiencing. After I came home from that hospital stay, I had to reintroduce my meds. And right before introducing pyrazidamide, it came back that I had bovine TB. Then we started asking all these questions. One, how did I get TB was always a question, but then two, how did I get bovine TB? I was now the 5th person in Michigan in recent years to be diagnosed with it. And so we started going back through camera rolls, through just like family memories, trying to figure it out. And we came across this one memory of there was this sick deer up north in Curran, Michigan, where my family has a cabin, and this woman, one of our neighbors, had nursed it back to health, and we were all going and feeding the deer. And my brother actually had a camcorder, and so he was recording all of us feeding these deer, and that was the only thing we could come up with how I could have gotten this. And then we ended up getting a DNA match from the germ I had to an exact match of deer in that same population. Yeah, so I never thought anything about that. I forgot that I even fed that deer. I actually argued with my parents that I'd never fed the deer, but turns out I did. Then I was in isolation still. I was in isolation for 2.5 months. It was so lonely. It was so sad. I was in my bedroom and you know, like my meals would have to be delivered to my door. I was wearing masks around everybody. But in December 2020, I came out of isolation. I was so happy to finally be around people. But I did start to develop a wheeze again. I could start to hear my breathing and my chest started to get heavy. For a few months, I felt like I was doing a bit better mentally. I still had ups and downs. I still was having side effects from the medication, but overall, I was feeling a lot steadier, even with my lungs feeling heavy again. On May 8th of 2021, I had a bronchoscopy scheduled for mid-treatment. The week before, I called my doctor and said that I was in a lot of pain, and I felt like my lung was collapsed again. And they said that it likely wasn't collapsed and that there's not really a way for me to feel if my lung is collapsed or not, even though there is a distinct feeling that I have felt every single time it's been collapsed. And because I had a bronchoscopy scheduled, they just wanted me to hold out until that bronchoscopy. My bronchoscopy took over an hour. My lung was totally filled with a germ again, and I came out of it diagnosed with a second disease on top of TB called aspergillosis. I was referred to even more doctors, an immunologist, an ID specialist, and my pulmonologist set everything up for me, all these appointments to see all these different specialists, which was so incredibly helpful because I was in no state to be able to reach out to people or make those appointments. So having my doctor do that was so, so helpful. I was put on voriconazole, despite knowing that there's negative interactions with TB medication. And the first day I took voriconazole, I said, I feel like I'm getting hepatitis. I can feel it. I feel the slightest bit of specific nausea, and I just knew. I called my doctor immediately, but they said to just try it out. They said that I wouldn't be able to tell if I had hepatitis that soon. And if this didn't work, then I'd likely be put on a PICC line, which sounded just like another horrible thing to happen that I didn't want to do. Within a week of starting the meds, I felt incredibly nauseous. I couldn't eat. I was throwing up all the time again. So I called my infectious disease doctors, and they told me that I was going to have to stop voriconazole and get put on a PICC line. When I got that news, I screamed. I screamed and I sobbed and I pleaded, and I was just screaming bloody murder through my house. I just didn't want to do it anymore. I wanted all of it to end. I didn't care if I died at that point. I just could not take the pain. I wanted to stop all my medication. Everything just kept getting worse and worse and worse. Anytime I started to get better, something worse would come along. That day was so traumatic, I don't even remember making it to the hospital, but I know that I was back in the hospital with ALTs over 1,000, and I got the PICC line put in. Some time went by. I started to feel better. I started to find a new normal with the PICC line and having an hour of my day hooked up to meds. And I had an end date that I held on to so tightly because my treatment had been extended multiple times now from every time I got hepatitis. And I was able to start seeing my friends again. During that summer, I got hepatitis again. My lung collapsed again. My treatment date got pushed back again. And at the same time, my white blood cell count began decreasing dramatically. I was sent to a hematologist for shots to increase my white blood cell count, and it worked while I was getting the shots. And I was also moving back to college at this time, moving into an apartment. I was having to drive back and forth from Lansing, so I was driving about an hour back and forth, and it worked while I was getting the shots, but as soon as I stopped, my white blood cells went on the decline again. I was told, we're just going to try to make it to the end of treatment. I was on a college campus trying to avoid COVID because I was told that I would not survive COVID. And I was begging and begging and pleading with my nurse to just let me stop taking the meds. I had taken so many extra medications because I had to reintroduce them so many times, and I just couldn't understand why those didn't count, and it frustrated me so bad that none of that counted. But she is just such a compassionate human, so kind, let me talk through everything I was feeling, let me rant, she let me cry to her. She would spend so much time talking to me, just helping and encouraging me that I was almost done. And I truly don't know how I would have made it through my treatment without having her and being able to reach out to her whenever I needed. September 21st, 2021, just one day shy of a year from the first time I went into the hospital, I finished my treatment. I was so relieved to be done with this medication. I thought that I could finally start living my life again, but I still had breathing issues. I still had low stamina. I still had all these side effects from the medication. I was still severely underweight, and it was a very difficult reality to face because I just kept feeling like once I make it to that day, everything will be better. But I still had a long, long time through recovery, and I'm still going through recovery. Present day, I am significantly better than how I was. I no longer have asthma, and my breathing is better, but I still have difficulty breathing. I still get stabbings in my lungs. And I find myself seeking out other people's stories, their experiences with doctors, within TB, and with other health concerns. And I found so many stories about women not being believed, their pain being dismissed, and it makes me so angry. So angry that women's pain is so often dismissed. And that's a huge reason why I continue to talk about my experience. My doctors are great people, great doctors, very kind people. But these biases impact everyday people. It is not unique to specific doctors. It is not unique to bad people. Everybody has biases, and it's so important for there to be a shift in medicine to believe women and to take women's pain seriously. I've struggled a lot with what I went through. The anxiety I have from my experience, I've had to go through so much therapy, and work through so much trauma, and also through We Are TB. Getting connected to the organization We Are TB has been one of the most helpful things for me. Being able to talk to other people who have experienced this and people who understand what it's like to be treated for a disease that still needs so much research, that still needs so much more understanding, especially with bovine TB. I hear so many conflicting opinions about things that impact it, the way it moves, the way it grows in our body, and being able to talk to people about it has been so helpful. So I'm so thankful for We Are TB, and I'm so thankful to be able to come and talk about my story. So thank you.
Adriana, thank you so much for sharing your story. It's so inspiring. And thank you, Lisbeth, as well. We have a few questions in the chat, so we can just start. First, for Lisbeth, Balaco asked, do you think the lesions in your brain are also due to Mycobacterium bovis?
They never did biopsy from my brain. Only they diagnosed with tuberculosis because they determined that because my tuberculoma was shrinking because of the medicine. Mm-hmm. But probably it's the same bacteria because it was running very fast around your body. And I started with the symptoms since November of 2022, but I was diagnosed until March of 2023, so I have a lot of time without medicine. So definitely it's bovine TB too.
Okay, thank you. And another question from Balaco, but this time for Adriana. Have you ever eaten deer meat?
I think I have once, but they traced it back to, like, they did an exact DNA match, and I don't think I've ever had deer meat from the area that my cabin is from, and the DNA match is an exact match to the population in that area. So that's how we concluded that it's from feeding the deer. I don't know how many times they fed the deer. I don't know if it was once or a couple of times, but that's just the best answer that we could come up with.
Thank you. We have a couple more questions. Stacy asked, Lisbeth, did your care team discuss with you ways you may have contracted the disease? And if so, were they able to determine the source?
No, actually, no. I never talked with my doctors because they never went empathic with me. They never explained anything about side effects, about to take B12 during the treatment, about take probiotics. So I expect all the symptoms, but I has been very bad. Even now, after my treatment, I have neuropathy for the medicine because I took the medicine for 2 years without stop any day. I never stop. So I never talk with them. I know everything because I search information from CDC, from We Are TV, from Somos TV, from Adriana. She was the first person that I met who had the same bacteria like me. So
Me too.
they never, even between each other, they never talked between each other. Even the doctors was in the same building. I never talked with them about this. So they only told me, you finish your treatment, you are a TV survivor, bye, and that's it.
Thank you, Lisbeth. There is a question which I think Adriana already kind of answered. It says a question from Stacy saying, was your exposure to the sick deer, you mentioned a single exposure one time, and you said you weren't sure if that was one time or more, right, Adriana?
Sorry, say that again.
Your encounter with the deer, the question was your exposure to the sick deer a single exposure or one-time exposure?
Right. Yeah, I'm not exactly sure. I don't even remember feeding the deer. Like I said, I literally argued with my whole family. It was like I wasn't there. And then they pulled up a video of me doing it. So I don't remember.
Yeah, that's fair. Let's see. Trying to, I wrote the questions that were before, but there's new ones now. It says, Adriana, how much time after this contact with the deer you started experiencing symptoms?
So I was 9 years old when that video of me feeding the deer was, and then I was 19 when I started experiencing symptoms. So it was a decade that had passed. Yeah.
Could I throw in a question? Yeah, Elizabeth, do you remember drinking unpasteurized milk at any point?
Maybe when I was a little kid, probably my grandma gave me a unpasteurized milk, but it was when I was a little kid. I really don't remember. The doctor told me it could be a possibility. It's the only way. Maybe that's.
Yeah, hard to know.
Yes.
Yeah. And Adriana, do you recall any discussion of besides obviously was there extrapulmonary tuberculosis diagnosed?
No, it was just in my left lung the whole time, even the second disease. Mm-hmm.
Very interesting.
Yeah, a couple of people in the chat mentioned queso fresco or cheeses. Those are also another source of contamination or infection.
Yeah.
There was a question asking if these cases were published or if there is a plan to publish. Do you know if any of your cases have been published as case reports?
I know that mine has been published. Can't remember where it was published, but one of my doctors wrote a paper on it, and then there's quite a few articles as well on it.
About me, I don't think so. I think you are the first one that you know about my story and in the TV support groups, but I really don't know if there's any information about my case.
Thank you. And if there are any other questions, feel free to raise your hands and speak them into the audience or write them into the chat. I don't know, Fred, have I missed anything?
Nope. I think we've got it all.
Nothing.
Oh, there we have a couple more questions.
Yeah, and I think Natasha had her hand raised.
I lost everybody for a second. Are we back? Somebody shared the papers from Jim in the chat, so.
Natasha Pontes would like to ask a question, so I think you can just unmute.
There's a lot of comments on the chat.
I also have seen.
Hello. I will ask in the microphone.
Yes.
Good afternoon. I'm Natasha from Brazil, and I would like to ask actually for the after treatment, if the doctors explained anything about the maybe the risk or possibility or of the disease starting again or coming back, like being silent for any reason after the treatment, and you start to experience symptoms again, if this is a risk or not, if someone talked about this possibility perhaps. And thank you again for Adriana and Lisbeth to share your story.
When you finish your treatment, the bacteria is completely gone, but it's not impossible to get tuberculosis again because you all are always exposed with other people. So the first bacteria is gone, but you are available to get tuberculosis again. So you have to be to take vitamins, to be healthy, exercise, wear mask if you are with in a crowded place. You have to wear mask or something like that to prevent to not get again tuberculosis. But unfortunately, if you finish your treatment, you are very good with the tuberculosis with the first bacteria, but you are able to get tuberculosis again, but it's maybe from the 10%, 100%, maybe 5 or 3% able to get tuberculosis again. So you have to be healthy, very, very healthy, and take vitamins.
I saw a question a couple of times. Someone asked me if I've addressed my doctors. So I'm glad that y'all asked. So my doctors to the health department loved. I never had any concerns through the health department. I received the most amazing care, and they genuinely, like, they came to my house, sat down, and got to know me as a person. I had such great experiences with the health department. My doctors through the hospitals where I struggled more, they didn't see me as much. And I think that's part of the disconnect that we had, is there was less face-to-face, I think. I haven't addressed them because, again, like, they're great doctors, they're great people. Like, I just think that there's this overall issue in health as a whole with believing women, and I think that everyone can reflect on, their own biases that we all have and try to work through those and just try to be better caretakers. And I mean, I also recognize that this was a very difficult case for my doctors as well. They were confused about what was happening. They didn't have as many answers. There isn't enough research on TB or bovine TB. I was the 5th person in Michigan in recent years, so some of them had never had a case like this. So I do understand why they also had so many questions, but definitely, if I was heard, I think that some of my treatment wouldn't have gotten to the point that it did when I finally was, treated for the things that came after. So yeah.
Thank you so much, Adriana. We are at the time, so just in the interest of respecting everybody's, we did say this is a 1-hour webinar. Thank you both for your testimonials and your brief story. I hope your health is only going to be getting better as we move forward. And thank you for everybody who asked questions. And then you will receive, everybody that attended and registered will get a follow-up email with some pertinent information about webinars and the union and the subsection, the Zoonotic TB subsection. We're really grateful that you decided to spend this hour with us, and grateful for Lisbeth and Adriana for sharing their stories. And I think it should be more talk about, as you said, Adriana and Lisbeth, just believe in women. And when we say symptoms, just like advocating for that. And thank you for putting a little bit more lights in that. That's a great intersection between zoonotic TB and just general medicine. And with that, Fred, is there anything you want to add before we close?
This was an amazing experience, and I really commend you two for what you have been pushing after your trauma. It's really, really amazing, and thank you so much for helping the world.
Thank you for giving me this opportunity to share my story. And if somebody here has tuberculosis now and it's on the treatment now, I always say, please ask to your doctor if you can take B vitamin, because it's very important to protect your nervous system, and take antibiotics to protect your stomach, because they never explained to me, and now I suffer a lot for that. So please ask to your doctors.
Thank you, everybody, and have a great rest of your day.
Thank you all.
Thank you. Enjoy the day.
Bye.
Bye.
All the best.